Hello everyone, and welcome to this presentation of maintaining upper body motor control, strength, and power exercises for the dancer, Part 1. My name is Dirk Hartog, and I work as a physical therapist at Westside Dance Physical Therapy. I also work as a strength and conditioning coach with the dancers of New York City Ballet and the School of American Ballet. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or read on the site. In case of an emergency, please call 911. You should not push through pain and/or participate in these exercises if you are recovering from an acute injury. Please consult a physician or rehab specialist before initiating an exercise program. Since many of us are stuck inside away from our normal routine, it is important that dancers include resistance exercises and review principles that will keep their upper body strong during COVID-19. Many of us lack the usual gym equipment at home, and so understanding how to use body weight and other household items are useful strategies. In Part 1, we will discuss low-intensity exercises that will prepare your body for more challenging ones. In each subsequent part of this three-part series, we will look at a gradual progression of loads using muscle groups used during partnering and floor work. Three categories of exercises we will focus on in Part 1 are range of motion, quadruped, and common plank positions. This series is geared toward any dancer who will need to be prepared to return to partnering, floor work, or acrobatic skills requiring their upper body. These exercises can aid in preventing any deconditioning while the stay-at-home policies are still in place. Supplemental cross-training also has been linked to reducing the risk of injury and enhancing dance performance. Upper body resistance training is also recommended in maintaining overall health. The exercises presented can be done before a virtual class as part of your warm-up or added into your current exercise routine. Since the exercises can be done with minimal to no equipment, the space in your home should be sufficient. When assuming a weight-bearing position, here are some tips that will help you find stability and distribute forces evenly throughout your upper extremity and trunk. Maintain a neutral spine and pelvic position starting from the head and neck down to the sacrum. To get organized in a weight-bearing position, your arms should be approximately 90 degrees from your trunk and perpendicular to the floor. In quadruped, your thighs should also be positioned perpendicular to the floor. Comfortably position your hands about shoulder width apart and try not to lock into your elbow hyperextension. If you begin to experience any wrist pain when doing any upper body weight-bearing exercises, try to bring the wrist into a more neutral position. This can be achieved by rolling up the front of your yoga mat, placing folded or rolled up towels under the base of your palm, or use free weights as handles. If kneeling becomes bothersome for your knees, place a pillow or rolled up yoga mat underneath your knees for cushioning. There are many variations of these movements that may impose different challenges. Again, the goal of Part 1 is to provide upper body exercises to develop the foundations before adding in higher intensity work. If you begin to experience any pain or discomfort, check your technique, reduce the load by returning to a lower intensity exercise, and/or reduce the number of repetitions. Strength adaptations occur over time as we strategically balance progressive loading and recovery. If these exercises are new for you, begin with lower reps and more rest time between sets. It is recommended to allow 1 to 2 days between sessions that incorporate upper body exercises. Although we will focus more on bodyweight exercises for the upper extremities, the involvement of the trunk and lower extremity during certain lifts cannot be overlooked. In Part 3, we will look at how we can integrate our upper extremities with common lower body exercises and positions to mimic the stress when partnering. We will also look at how we can utilize any minimal equipment we have or convert household items into weights. Presented here are a list of low-intensity exercises to challenge your motor control and strength. These will allow you to begin exploring your movement and readiness to continue onto more difficult exercises. Thoracic spine and ribcage mobility are important components of overall shoulder girdle function. Our goal is to isolate rotating from our thoracic spine without movement into our low back or pelvis. We begin challenging our thoracic range of motion in sitting, then standing. First with both arms out to the side, then overhead. Rotate to one side, then the other, remembering to move slowly, attending to where the movement is occurring. This next exercise allows us to begin developing a sense of how our shoulders move through their full range of motion. Begin with the backs of your hands on your back pockets. Lift your hands off and begin to rotate your arms around to your side, continuing to lift them overhead. Your thumbs are pointing behind you when you reach the top. We begin our weight-bearing exercises with cat-cow. The goal here is to move our spine slowly through a pain-free arc of flexion and extension. Avoid going into end ranges if they reproduce any pain or discomfort. Scapular push-ups are the beginning stages of the traditional push-up. Maintaining a neutral spine position and without moving your elbows, sink towards the floor, allowing your shoulder blades to come together. Push through your arms, returning back to the starting position with your shoulder blades wide against your back. Progress your quadruped position by extending one leg behind you and reaching the opposite arm overhead, leaving two main points of contact on the floor. You can increase the challenge by hovering the leg half an inch off the floor as you reach it back. For points of contact, we increase the load through our upper extremity muscles by stepping our feet back to a push-up position, holding for 1 to 2 seconds, and then returning back to quadruped. Try keeping the pelvis from rotating as you step back to push-up position. Here we begin to incorporate a push-up type exercise. The wall push-up shown here is different than a traditional push-up. Position yourself 3 foot lengths away from the wall and find the arm position used in the other weight-bearing exercises. Focus on controlling the scapular position as you lower your forearms to the wall and push back to the starting position. Developing a strong plank position is helpful to continue loading our upper bodies as higher level exercises require optimal trunk control. For forward plank, start on your hands and knees. Walk down to your forearm so that your upper arm is perpendicular to the floor. The midline of your trunk and thighs should approximate a straight line. To make a plank more difficult, we eliminate a point of contact. Start in a side-sitting position and lift your arm out to the side at a 90-degree angle to your body. Bend your elbow and slowly lower down onto your forearm. Lift into side plank. Your elbow should be just underneath your shoulder. Also check that the midline of your breastbone is aligned over the midline of your pelvis. I hope you picked up some valuable information. If you have any questions, please reach out to us on our website or connect with us through Facebook or Instagram. Thank you for watching and stay healthy.